Hi, this is Gene Ransom with MedChi, the Maryland State Medical Society, and I am going to give a quick review of some of the bills that we passed relating to preventing insurance denials in this last 2025 session. It was a really good session for MedChi. We had some nice defensive wins, but we also had some big wins when it comes to insurance reform. For those of you who don't know, MedChi is the seventh oldest medical society in the United States, formed in 1799, and we represent physicians, patients, and the public health of Maryland. For this session, one of the things we really wanted to focus on from a proactive point of view was passing insurance reforms. We actually did pass some mandated benefits as well, but I want to focus on this denial issue. And more, we've had physicians complaining about denials of reasonable and needed care in different ways. So we wanted to really focus on patient protections and clinical decision making, making sure that insurance carriers were held accountable. The first bill that we worked on, and this really came directly from our president, Dr. Padmini Radisingh, was the idea that use of artificial intelligence in utilization review, reviewing whether something's approvable or not by an insurance carrier or pharmacy benefit manager, needed to not just be used without having a physician or someone else look at it. The tools had to be used responsibly and transparency, had to look at the patient's specific clinical history and not just be based on algorithms. And the final decision had to be made by the physician in the same specialty. While obviously AI is going to be an important tool as we go forward, we need to make sure that it does not replace the clinical judgment as a physician. And we need this important check. So this legislation was passed and signed into law earlier this year by Governor Moore. Second, we also passed legislation increasing the amount of power the insurance administrator has to enforce bad acts by insurance companies. The Health Insurance Adverse Decisions, Notices, Reporting, and Examinations Bill passed this session and was strongly supported by MedChi. It increases transparency with regards to denials. It creates reporting standards for insurers and protects patients from unexplained or excessive denials. This was another nice victory piece of legislation that was passed this year, and hopefully will put the insurance companies on notice that they can't just make willy-nilly denials for no reason. So those two protections passed. Those aren't going to be enough, and obviously we have a lot of work to do, not just in Annapolis, but the federal level. So we also passed legislation, worked closely with the sponsors of legislation to pass an adverse decision work group. And this state work group is going to study this rise in adverse decisions by insurance companies. It establishes a state work group to review denial trends, recommend strategies to reduce adverse decisions, and standardize payer reporting. It aims to identify systemic issues and recommend legislative solutions. This is something MedChi has been doing. We work closely with a couple items of litigation around this. Specifically, we just completed helping people sign up for their rights under a judgment against or settlement against National Blue Cross Blue Shield. And right now, we're joining an AMA lawsuit against MultiPlan for insurance abuses. So we are looking at legislative, we are looking at litigative, we are looking at any solutions we can to solve these insurance abuses. These three bills are three pieces of legislation that we passed in the General Assembly this last year that show how important reining these insurance companies in is to our physician members, but maybe more importantly, how important it is to our patients. Thank you for listening today. And please reach out to MedChi if you want more information on any of these bills or any of our other work in attempting to improve our ability to be treated fairly by insurers. This is Gene Ransom at MedChi, the Maryland State Medical Society.